Next video, we're going to be going through general cervical range of motion exercises to help regain certain motion and movements that we may be limited into the neck. Very simple exercises. Essentially what we're going to be doing is taking that head, we're going to look all the way down, nice focused controlled motion looking down. We're going to take that neck, we're going to look all the way up at the ceiling. Now notice how I'm not going extremely fast through these ranges of motion. It's nice controlled intentional movements that we're restoring into the neck. So we're flexing and extending the cervical spine and the neck in this position. So this motion and movement we're gonna do for about 20 to 30 seconds in each plane of motion. After we've gone forward and backwards, we're gonna do side to side, what we call lateral flexion. So bending that head and neck all the way over to the left side, all the way over to the right side. Really trying to reestablish that bending motion into this part of the neck. What you can do it on the last few sets of this, or maybe closer to that 20-30 second window, you can place your hand right on top of your head. You're not pushing on this, it's really just the weight of your hand extending onto that head. Does get a little bit more force and just a little bit more tissue resistance at that end range of motion. And then lastly is gonna be our rotational movement. So we're gonna really be working on rotating that head to the left, nice controlled motions, and rotating that head to the right. So back and forth in both directions. Again, we want this to be controlled, intentional movements as we're going through this. Again, there shouldn't be pain associated with this. If there is, let one of the doctors know on your next visit if this is something we maybe need to modify.